2 diabetes is a disease caused by various genetics and lifestyle factors, including family history, obesity, and a sedentary lifestyle. According to a 2017 National Health Survey conducted by the Australian Bureau of Statistics, 1 in 20 Australians aged 18 and over have type 2 diabetes, and another 2 million are at risk of developing the disease. In this video, we will be covering an overview of type 2 diabetes, the effects of diabetes on oral health, and lastly, management of the disease. Firstly, what exactly is type 2 diabetes? Type 2 diabetes is a condition where the body becomes desensitized to the hormone insulin, which helps us manage our blood sugar levels. Despite the body producing normal levels of insulin, it is not achieving its intended effect on target cells. As a result, blood sugar levels become abnormally high. If not managed properly, it can damage our nerves, kidneys, retina of eyes, and leave us susceptible to developing heart disease in the long run. Not only that, there is also increasing evidence that poor oral health is linked to poorly managed type 2 diabetes. So, what are some possible signs of type 2 diabetes in the oral cavity? These oral presentations include periodontal disease, dry mouth, frequent oral infections, burning mouth, and slow healing sores. It is also important to note that these presentations are highly interlinked with one another. Now, we will be covering the first 3 signs of type 2 diabetes within the oral cavity. Firstly, patients with type 2 diabetes are at increased risk of developing periodontal disease. Periodontal disease refers to the swelling of gums and bones that support the teeth. Patients with periodontal disease may find that their gums are tender to touch and susceptible to bleeding. Early stage periodontal disease, also known as gingivitis, is reversible if treated. However, if left untreated, it can progress into periodontitis, which is a chronic inflammatory condition of the gums and periodontal tissue. Eventually, the inflammation will spread deep into the bone underlying the gums and lead to tooth loss. Next, type 2 diabetes can lead to dry mouth. Studies have shown that dry mouth is more frequently reported in diabetic patients, leading to reports of frequent thirst. This increased thirst is likely due to changes to the quantity and quality of saliva produced. Not only may patients experience increased thirst, these saliva changes leave them more susceptible to gum infection and tooth decay as well. On top of that, changes to saliva composition may lead to changes in taste, which may affect the quality of life of patients. It is thus important to ensure patients get their diabetes under control to prevent the risk of developing dry mouth. Thirdly, diabetic patients are more prone to oral infections. When these patients experience infections, symptoms tend to be more severe as well due to them having a weaker immune system. Infections of the oral cavity can be fungal or bacterial in nature. Depending on the cause, symptoms and treatment can differ. One of the most common fungal infections is oral thrush, characterized by white patches over the oral mucosa. There are several factors that can predispose patients to infections. This includes smoking, wearing dentures, poorly managed diabetes, and the use of steroids and antibiotics. Patients should thus try to avoid smoking and taking unnecessary medications. Apart from periodontal disease, oral infections, and dry mouth, patients with poorly managed diabetes may experience other symptoms such as burning mouth and can also take a longer time to recover after treatment. As such, they may require closer monitoring and tender care after invasive procedures. With the various effects that diabetes have on different parts of the body, patients are thus advised to get their diabetes under control first in order to achieve optimal dental treatment outcomes. Lastly, how do we manage type 2 diabetes? The mainstay of type 2 diabetes management is through lifestyle changes such as diet, exercise, and maintaining a healthy weight. According to the Australian Dietary Guidelines for diabetic patients, one should limit alcohol consumption, eat a diet low in fats, maintain a healthy weight, and exercise at least 30 minutes a day. If lifestyle changes are insufficient, medication to lower blood sugar levels will be incorporated in a progressive manner. Due to their predisposition to oral diseases, patients are also advised to visit the dentist at least twice a year. Remember, there is no cure for type 2 diabetes. Therefore, prevention is the best cure. Thank you.